Hey everyone, it's Twin Boy here. In today's video, we'll be discussing 7 different types of acne. Knowing what you're dealing with is the first step to getting that clear skin you're after. But before we dive in, make sure to subscribe and turn on notifications for new updates when we publish a new video. Don't forget to like, share, and comment. Now, let's get started. Alright, let's talk about nodules. These guys are like those deep, painful pimples you feel coming on for days. They're large, inflamed bumps that sit deep within the skin. Trust me, you'll know it when you feel one. They're firm to the touch and can be really tender. What makes nodules tricky is that they form so deep down, over-the-counter treatments often can't reach them. That's why seeing a dermatologist is key. Nodules can leave behind some gnarly scars if they're not treated properly. A dermatologist can prescribe medication that tackles those deep-rooted bumps and helps prevent scarring. Now, cysts. These are like nodules' bigger, badder cousins. We're talking large, pus-filled lesions that almost look like boils. Just like nodules, they can be super painful and you definitely don't want to pick at them. Squeezing or popping them yourself can actually make things worse and increase the risk of scarring. Cysts also tend to form deep within the skin, so those over-the-counter creams might not cut it. If you're dealing with cysts, it's time to call in the professionals. Dermatologists can provide the right treatments to shrink those cysts and minimize the chances of any lasting marks. Okay, let's take a breather from the intense stuff and talk about mild acne. This is the most common type of acne, and the good news is, it's usually pretty manageable. We're talking about those pesky whiteheads, blackheads, and the occasional inflamed bump. If you have fewer than 20 whiteheads or blackheads, under 15 inflamed bumps, or less than 30 total lesions, then you fall into the mild acne category. The go-to treatment for mild acne is usually over-the-counter topical medications. These creams, gels, or washes often contain ingredients like benzoyl peroxide or salicylic acid, which can help unclog pores and reduce inflammation. Keep in mind, it can take some time to see results, usually around 8 weeks. So, be patient and consistent with your routine. Now, if you're dealing with 20 to 100 whiteheads or blackheads, you might be feeling a bit overwhelmed. These small, yet persistent blemishes can be quite a nuisance, and if you have 15 to 50 inflamed bumps, it can be even more frustrating. These red, swollen spots can be painful and hard to manage. Or perhaps you have a total of 30 to 125 lesions, which is a clear sign of moderate acne. This level of acne can affect your confidence and daily life. At this stage, over-the-counter products might not be enough to tackle the problem. These products are great for mild acne, but moderate acne often requires a stronger approach. Don't worry though, dermatologists have a whole arsenal of prescription medications that can help. They are trained to assess your skin and determine the best course of action. These medications often come in the form of topical creams or gels, which you apply directly to the affected areas. These treatments can help reduce inflammation and kill bacteria. But your dermatologist might also recommend oral medications depending on your specific situation. Oral medications can work from the inside out to balance hormones and reduce inflammation. One thing to keep in mind with moderate acne is that it might seem to get a little worse before it gets better. This can be discouraging, but it's a normal part of the process. This is because some medications can cause a bit of purging, where they bring everything to the surface. This purging phase can be tough, but stick with it. It's a sign that the treatment is working. It can take several weeks to see improvement, so patience is key. Documenting your progress can help you stay motivated and see the changes over time. But with the right treatment plan, you'll be well on your way to clearer skin. Trust the process and follow your dermatologist's advice. Clear skin is achievable with persistence and the right care. Alright, now we're getting into the serious stuff. When it comes to skin health, there are some conditions that you simply cannot afford to ignore. Severe nodulocystic acne is a whole different ballgame. This isn't your run-of-the-mill breakout that you can treat with over-the-counter products. This type of acne is characterized by multiple inflamed cysts and nodules, often covering a large area of skin. These lesions are not only unsightly, but can be incredibly painful. We're talking deep, painful bumps that can make your skin look red or even purple. The inflammation can be so severe that it affects your daily life, making it difficult to focus on anything else. Scarring is a major concern with severe nodulocystic acne because those deep lesions can really damage the skin. The scars left behind can be permanent, affecting not just your appearance, but also your self-esteem. That's why it's absolutely crucial to see a dermatologist as soon as possible if you suspect you might have this type of acne. A professional can provide a proper diagnosis and tailor a treatment plan specifically for you. Early intervention is key to minimizing scarring and getting those breakouts under control. The sooner you start treatment, the better your chances of preventing long-term damage. Dermatologists have a range of treatments for severe nodulocystic acne, including oral medications, topical treatments, and even injections. These treatments are designed to reduce inflammation, kill bacteria, and prevent new breakouts from forming. In some cases, they might even recommend procedures like laser therapy or chemical peels to help manage the condition and improve the appearance of scars. These advanced treatments can make a significant difference in the texture and tone of your skin. The journey to clear skin can be challenging, but with the right expert help, it's entirely possible. Before and after images of successful treatments can be incredibly motivating, showing you that there is hope and a path to healthier skin. Remember, seeking expert help is not just about treating the symptoms, but also about understanding the underlying causes of your acne. A dermatologist can guide you through lifestyle changes, skincare routines, and medical treatments that are best suited for your skin type. So don't hesitate. If you're struggling with severe nodulocystic acne, make an appointment with a dermatologist today. Your skin will thank you, and you'll be on your way to a clearer, healthier complexion. Acne conglobata is one of the most severe and rare forms of acne. It is a chronic skin condition that can cause significant distress and discomfort for those affected. It's characterized by interconnected nodules under the skin, and it can be pretty aggressive. These nodules are often inflamed and can merge to form larger, more painful lesions. These nodules often form deep, painful bumps that can leak pus and leave behind significant scarring. The scarring can be both physical and emotional, impacting a person's self-esteem and quality of life. Acne conglobata typically affects areas beyond the face, like the neck, chest, arms, and buttocks. This widespread distribution can make the condition even more challenging to manage. This type of acne is more common in men and can sometimes be linked to the use of steroids or testosterone. Hormonal imbalances can exacerbate the condition, making it more difficult to treat. Because of its severity and potential complications, it's crucial to seek treatment from a dermatologist right away if you suspect you might have acne conglobata. Early intervention can help manage symptoms and reduce the risk of long-term scarring. Treatment for this type of acne is often complex and may involve a combination of oral and topical medications, along with other therapies to manage symptoms and prevent further scarring. Dermatologists may prescribe antibiotics, retinoids, or even hormonal treatments to address the underlying causes of the condition. In some cases, additional treatments like laser therapy or light therapy may be recommended to help reduce inflammation and promote healing. These advanced therapies can be particularly effective in managing severe cases of acne conglobata. Support from healthcare professionals, as well as from friends and family, can make a significant difference in coping with this challenging condition. Joining a support group or connecting with others who have similar experiences can provide emotional relief and practical advice. Lifestyle changes, such as maintaining a healthy diet and regular exercise, can also play a role in managing acne conglobata. Reducing stress and avoiding known triggers can help keep flare-ups under control. A consistent skincare routine, tailored to your specific needs, is essential in managing acne conglobata. Using gentle, non-comedogenic products can help prevent further irritation and promote skin healing. With the right treatment plan and support, it's possible to manage acne conglobata effectively and improve your quality of life. Remember, you're not alone in this journey. and help is available. Last but not least, let's talk about acne mechanica, also known as sports-induced acne. This type of acne is triggered by heat, friction, and pressure on the skin, often caused by things like helmets, hats, or tight-fitting clothing. Athletes or anyone who wears a lot of sports gear is particularly prone to acne mechanica. The good news is that acne mechanica is often preventable with a few simple steps. Wearing breathable, moisture-wicking fabrics under your gear can help reduce friction and sweat. Showering immediately after exercising and washing your sports equipment regularly can also make a big difference. If you're already dealing with acne mechanica, don't worry. Your dermatologist can recommend treatments to help clear up those breakouts and prevent future ones. Well, there you have it. We've covered 7 different types of acne, from those pesky blackheads to the more severe forms. Remember, knowledge is power when it comes to your skin. The more you know about the type of acne you're dealing with, the better equipped you'll be to find the right treatment and get on the road to clear skin. Don't hesitate to reach out to a dermatologist if you need help identifying your acne type or finding the right treatment plan for you. And as always, keep those pores clean, stay hydrated, and be kind to your skin.